Hello friends, welcome to my YouTube channel. I'm Hima, and if you're new to my channel, I make videos on motherhood, arts and crafts, travel and photography. If these topics are something of interest to you, please do subscribe to my channel. I post videos every week. And today's topic is on thrush, and this is a very common occurrence in newborns. So what is thrush? It's a fungal infection. So these usually occur in mouth, but then you can also see them on the lips, and that is why you have to be very vigilant when it comes to babies. You always have to watch them, what's going on, because in my daughter's case, when she got thrush, she wouldn't open her mouth, so I didn't even realize that she had thrush. And then I saw some small white patches on the lips, and that's when I knew something was a problem. But then again, I was thinking it's some kind of a blister, only to know that it basically was a fungus infection when we actually visited the doctor. So these are some things that you have to be very careful when it comes to newborns. You always have to keep an eye on the small details, because those things actually make a difference, and because they don't say and they're not communicating, it's very hard to know what's happening. And she was not eating properly, and she had diaper rash, and we were thinking that it's just a diaper rash. It actually was a fungus infection which was in the diaper area. So babies would usually be fussy, they will not be eating properly, and that's when we realized that something was not right. And then we tried to give her diaper rash cream, and that did not work, and that's when we realized that something is not right. Again, this is not fatal, and this is very common in newborns, and babies will feel soreness in their mouth, and that will make them fussy and irritated. So when I say fungus, yeast is a kind of fungus. So this is caused by yeast. So it's called as thrush, or it's also called as yeast infection. So thrush mainly is caused by yeast-like fungus called as Candida Albicans. We all have this yeast in our mouth. However, it's the overgrowth that's the problem. And newborns specifically are more susceptible to these because they have very weak immune system. Having said that, it's not just newborns, even adults can be impacted with this. This also occurs in adults who have weak immune system or are taking certain medications or have certain health conditions. So this yeast or fungus, when they overgrow, that's when it's a problem. They look like cottage cheese, and they occur on the inner side of the cheek, in the mouth, on the tongue, and at the back of the throat. And this occurs even in very small babies, like even 3 to 7-year-old babies can also have this. And usually as the babies are growing, this goes away because their immune system gets strong. And as I mentioned before, you can also see the symptoms in the diaper area. So if the newborns do not have thrush and suddenly they start having, that could be for various reasons. One reason is if the baby is on antibiotics, then their immune system is weaker, and the second reason is if the mother has the yeast infection, then she can pass on to the baby. So those could be two reasons sometimes where they don't have it and they suddenly start having. And also an observation which we made in our case is when we were not removing the diaper immediately after a poop, that also caused this infection. And that's something you always have to be careful when it comes to newborns, is to change the diaper as soon as possible. And also one thing that we have learned from our experience is to change the diaper as soon as possible after a poop. And these white patches or yellow patches can be very hard to detect sometimes, because when babies drink formula, their tongue also has some white patch, because formula does leave some residue on the tongue. Sometimes it can appear that those white patches are because of formula. So that is why you have to be very careful when you see the spread of those white patches onto the cheek. In the diaper area, they'll just show up as small red blisters. So these are all different kind of things that you have to keep an eye on. And these patches are very sensitive and can bleed too. And when this happens, you have to change the diaper very frequently for the baby. And in case of breastfeeding mothers, because the mothers are feeding the baby, it can transmit from the mother to the baby. And if the mother is breastfeeding the baby, then mother can keep reinfecting the baby even when the baby has recovered. In those cases, you may have to think about alternative of temporarily pumping. However, doctors recommend not to stop breastfeeding, because the only way newborns are going to gain that immune strength is from the breast milk. And if you're breast pumping, then you have to be careful, because then you'll have to sterilize all the breast pump parts, any pacifiers, nipples, everything in the house has to be sterilized, so as to babies are not reinfecting themselves. And also in cases where the mother has the infection, it can also lead to a lot of pain and inflammation in the nip, and that may lead to discontinuation of breastfeeding as well. And because this occurs in the diaper area, sometimes even when you're giving a diaper rash cream, it will not recover because it's due to fungus overgrowth. And doctors also give an oral liquid medicine, which is also called as nystatin or mycostatin, if the thrush doesn't go away with the topical cream. In our case, she had given us both. The topical cream was for the diaper area and the liquid was for the mouth. Had to be given for the baby for 7 to 10 days. Even when you see that the thrush symptoms have gone down, you still have to continue to give this, as this is a course. So all these medicines are prescribed medicines, so you have to talk to your doctor on what works the best in your case. First thing is to clean all the pacifiers or bottle nipples in hot water or dishwasher after each use, and then store the prepared formula bottles in fridge, and do not reuse bottles if they're sitting around outside for a while, and then change diapers often, and do not stop breastfeeding as milk helps the baby with the infection, and monitor the child closely. And if there's any problems that you experience, you always have to talk to a doctor. In the first 3 months, any temperature above 38 degrees Celsius or 100 degrees Fahrenheit, you have to talk to your doctor immediately. If you have any questions or comments, do leave them in the comments box below. I hope this video was helpful for you. If you like this video, don't forget to give a thumbs up and do subscribe to my channel. I'll see you in my next video.